God, how hard is it to put a mask on your kid? He has allergies, you fucking Fauci zombies. What? Allergies? Oh, take it! It's not. You... Hey! What do you people think you are, huh? This ain't Philly?
As a woman who lives in Philly, I'm not going to say I take offense to that, but Philly is a good town. I need to speak up for Philly. I got a root for my city here. All right, so there's that. Obviously, this fight is a problem. Sometimes waiting rooms can get heated. People in waiting rooms, not just in ERs, but also in the doctor's offices. Every now and then this happens, but even more so. Did you see what they were saying to each other? There was some conversation, the two women, there was some conversation about wearing a mask. And one of the women called the other woman a Fauci follower. This sort of reminds me of the COVID days, at least the COVID pandemic days, when there were a lot of sort of people on different sides, okay? And then we heard them talk about wearing a mask, something about, you're not wearing a mask, my child has allergies, he can't wear a mask, etc. You remember that? Remember during COVID when people were fighting over masks? As a physician, this brings back almost a little bit of PTSD, but let's keep watching.
This is a hospital, for Christ's sakes. What's the matter with you? Call yourselves adults? Huh? There are children in here.
All I did was offer to put a mask on her child who's been coughing for over an hour.
First of all, masks are bullshit.
Once again, that mask debate still back on. PTSD. Oh my gosh. But can we just give a little credit to the nurse here? That way, nursesarebomb.com. Write in the comments if either you are a nurse, you're a healthcare worker, by the way, if you love nurses, which is all of us, write in the comments. Let's give our nurses a shout out because she's out here handling this, handling it.
I promise you'll be seen as soon as the provider is available.
But how can they become available if new people keep cutting the fucking line?
There's no line. We see patients by severity of need. As soon as we have your tests and labs, you will be seen.
This place is fucking unbelievable.
I know it's so frustrating going to the emergency room. As a family doctor, I often have to send patients to the emergency room for things I'm seeing in the office or symptoms that they're calling me about. And one of the questions they often ask is, am I going to have to wait? Well, the thing is, we can't ever predict that because oftentimes ERs are going not in the order in which you sort of checked in, but often based on severity and what else is going on. And I think we can all understand that, right? If somebody is bleeding out or is having an active heart attack or having an active stroke, we would want that patient to be taken ahead of, say, somebody who's there for a bite on their hand or something like that, okay? Not that the other is less important, but you see how in terms of severity and criticalness, there is a difference.
Saline.
Fuck it out, stitch me up and send me home.
It's a little more complicated than that. You got yourself a fight bite, which means a couple things. First, we need to determine if the bite extended into the joint space. If it did, you're going to need IV antibiotics and a trip to the OR to see a hand surgeon. Pinprick and a little burning.
Bites, animal bites, cat bites, dog bites, human bites, they need to be evaluated. They can be very, very serious and cause major infections. So make sure any bites you are being seen for.
Those of us who save lives for a living believe strongly that masks minimize risk when it comes to spreading disease and infection, but I want to respect your beliefs. So what do you think, with or without for surgery? Without?
I went with.
She chose the mask. That's the right answer.
We gotta cool this lady down.
Get some ice packs, head, neck, groin, send off a rainbow.
On it.
Heart rate 132, BP 210 over 120.
Let's talk about this scene. This is a patient coming in with an overdose of some substance. And as they wheeled her in, they said that she has a fever. She also has altered mental status, which means that either she's confused or obtunded or passed out or something like that. It means she's not thinking, mentating correctly or appropriately. And as you can see, that's the case. But the other thing, let's talk about the vitals. 132 is the heart rate. First of all, a normal heart rate is generally between 60 and 100. That's normal for most people. When you exercise, it can go higher than that. Some people have a little bit of a resting heart rate that's lower than that. 60 to 100. So when we're in the 130s, that's what we call tachycardic. That's a very elevated heart rate. Tachycardia can indicate things like infection, sepsis, and so many other things, problems with the heart, electrolyte imbalances, you name it. And that's one of the things we're seeing here. The other thing, her blood pressure, 210 over 120. Y'all, that is through the roof. Normal blood pressure is 120 over 80, 210. This is an absolute critical emergency.
Jesus, that's high.
4 of Ativan in the field.
It was a dilated, definitely MDMA overdose.
This patient overdosed on MDMA, also known as ecstasy. And by the way, I have to say, lots of amazing education happening here with the ER team and how they're treating this patient who is hyperthermic, which means their temperature is super high and they are obtunded and there's an MDMA overdose.
If you're in trouble, we can help you.
I'm not. Okay?
Will you at least take a look at this? There's a list of resources on the back.
I don't need that.
Emergency practitioners, physicians, nurses, PAs, etc., they're amazing for so many different reasons. Not only do they do all of this amazing trauma, but oftentimes they are a point of intervention for people who need help. And not just medical, physically medical help. I have colleagues who work in the ER who have said that a young woman or a young man or boy was acting funny, was able to sort of get them away from the person that they came to the ER with, found out that they were actually being trafficked, and were able to intervene. I have colleagues who work in ERs who are able to get patients to whether it's homeless shelters with social services or to domestic violence shelters, to rehab programs, save them from being trafficked, so many different things. I give a lot of credit to ERs because oftentimes it is a point of interception where people who are in dangerous situations can often find help. However, not everyone who is in a situation like this wants help or is ready for help.
16. More Ativan? Another 4, please.
Why is she on the ice, Dr. Santos?
To bring her temp down.
Wow, state the obvious, yet still don't answer the question.
The quicker we bring it down, the less of a chance for permanent damage to the brain, liver, or kidneys.
Exactly.
This scene is self-explanatory. Yeah, they literally use ice baths to cool people down who are hyperthermic or have high temperatures. There's other ways to do it as well, but this is critical for saving organs.
Second line and run a liter of LR wide open.
Still tacky at 115, BP's 180/72.
Airways patent.
The breath sounds bilaterally.
Pupils are equal and reactive.
Paula, do you know what today's date is?
Sats 94%.
Okay, so let's go over what vitals and what information they've gotten so far in the scene. We know that she was in a car accident. They're trying to figure out still what's going on, but a few things. We know that there was a second line. The African-American female physician placed a second line. She says LR wide open. That means lactated ringers. It's a form of IV fluids, and wide open means you're going to run them as fast as you can. Give them all the fluids they need. What do fluids do? They help with cardiovascular support and so much more, okay? And then the gentleman who is by the monitor right up on the wall, he said that the pulse or heart rate was 115. By the way, pulse and heart rate are the same. 115 is still higher than 100. 60 to 100 is normal again, but not as high as the other patient whose heart rate was 132. Her blood pressure was 180/72. It's high. Remember, the other thing I should say too is that when patients, like when we are sick and unwell, just in general, for any reason, some of the compensatory things that our body does to help us is oftentimes our heart rate will increase and our blood pressure will increase to help us. It's to sort of give us support. And that can happen when we're septic, when we have a full body infection. It can happen when we've been in a car accident. It's part of the adrenaline response, etc. So it's not unusual. I'm not surprised that their blood pressures and pulses are high, but it could be because of they're just going through stuff, or it could be some underlying cause, or both. So keep that in mind, though. So the other thing I'll say about that is, so when I see patients in the office that are sick, they're coming in, they have the flu, they have COVID, they have a cold, bronchitis, and they're just, oh my God, they're really, really sick. I don't get alarmed if their blood pressure is a little bit high because I know they're not well. Does that make sense? And sometimes their pulse may be a little bit higher than normal too. The other thing is, they checked for the airway. They said airway is patent. Breath sounds are equal. So that means the woman is breathing okay. And then looking into the eyes, they said pupils are equal and reactive. That means when you shine a light into your eye, your pupils should change size. That is a normal reactive response to light. And that's what we're looking for.
Oh, why's she seizing? She needs saline. We don't have her labs back yet. At festivals, you dance for hours, you sweat, you drink gallons of water, but nobody thinks to replenish their salts. It's low sodium, hypernatremia.
Okay, hyponatremia, low sodium. So this is something that I see as a family doctor, I would say a couple times a year, to the point where I have to send someone to the ER. And I usually see this in the context of people starting new diets or wanting to drink lots of fluids, or rather specifically lots of water on like a new diet plan or something like that. I've done videos, and I have videos on my channel that too much water, too fast and too high of volumes can actually lower your sodium and can potentially be deadly. If you Google, person dies from drinking too much water. It is a very real thing if you drink too much too fast over a short period of time, because what happens is the body's sodium gets dilute. Now, I think what they're suspecting here is that this patient was taking ecstasy, maybe she was at some concert or venue, whatever, drinking water, not replenishing electrolytes. But the thing about hyponatremia or low sodium, okay, is that it can cause seizures, which is what we're seeing here, even coma and potentially death. Low sodium is not a joke at all. And that's also why we tell people, do not drink too much water. You can't just drink water forever. It's not completely benign in those in certain volumes, high volumes, and too fast.
The over 500 hours of advanced training with lectures in simulation labs with senior faculty instruction. It doesn't matter. Your job is to shut up, listen, and learn, because so far today, the only thing you have been successful at is proving repeatedly that you know nothing.
This scene is not okay. It's happened to me. I would say probably many of us doctors who trained, you see, I went through training. I was a resident in like the early 2000s. A lot of things about medicine have changed, and they even changed for me, from people who came even before me. I was reamed out once by a surgeon. I know it happened a couple times. Once by a surgeon, definitely, and at least one other time. It's humiliating. It's inappropriate. It's infuriating in the sense that you just feel your blood boiling, you're embarrassed, you're shamed, and someone is doing that publicly, and they're yelling at you. It is not appropriate. It was not appropriate years ago, back in the day when I was training, and even before when I was training, for the folks way, way back in the day. And it's not appropriate now. That's not how you handle a situation like this. What I would also say is, Dr. Santos, what's really interesting is that, she actually in the situation was covering for the other doctor who didn't come up with the idea of using normal saline and that this could be hyponatremia. She actually is covering for that other doctor, which I think is actually that was kind of a nice thing that she did, given how sarcastic and sometimes dismissive she was in the past, at least earlier in the shift of other people's feelings. That's a whole nother thing. But anyway, not okay. Not okay.
Since we work together, maybe we could grab a coffee together sometime and you could help me get the lay of the land, so to speak.
I never dated anybody that I worked with in the hospital, not even med students, which that probably would have been fine because they were my classmates. I didn't date any med students, but I certainly didn't date anybody in the hospital or things like that. For me, I was just, again, I came through training in the early 2000s. I remember some of the earlier medical shows like ER and stuff like that, where people were having sex with each other in call rooms and stuff like that. I'm like, that ain't me. I was just always afraid of getting in trouble. I didn't want to risk my medical career, by, having relationships with people. It's not that I got asked out a lot or anything. That didn't happen. I'm just saying, even if it were an opportunity, I would have shied away from it because I just didn't want to get in trouble and didn't want my medical career to be jeopardized.
You asking him out?
No, what? No. It's just that I'm new here, so I just thought.
I don't date people in the workplace. It's nothing personal. It's never a good idea.
So I'm really glad he said that. I'm sure she felt embarrassed, but there's a couple things with the scene. First of all, they shouldn't have been having this conversation in front of a patient. She shouldn't have even, if she wanted to ask him out for coffee, she shouldn't have done that in front of a patient. He did the right thing by saying that he doesn't go out with people from work. I'm sure it took her aback, as it did, and embarrassed her. But, I do think that was the right decision. She shouldn't have had that conversation with him in front of a patient.
I'm leaving.
Hey, you are absolutely free to go, but if you do, you will be leaving AMA against medical advice. This form states that I have advised you to stay and complete your evaluation, but you are choosing to leave, understanding and accepting all risks of heart attack, stroke, disability, and death.
Yeah, leaving AMA or against medical advice. First of all, yes, we do have to have forms for you to sign saying that you understand that you are taking your health into your own hands. But I say never do it. Okay, if you're at an ER, if you're at a hospital, etc., to be treated, you're there for a reason. Something's going on. Please do not leave in the middle of a workup or if you need medical care, because the problem is you walk out on the street and you're by yourself. And the same problem still exists. So this is not an uncommon scenario, but yeah, we do have to get paperwork that says you understand you're taking your health into your own hands.
Oh! Crosby! Crosby! Oh. Ow!
I wanted to end this video on a light note because they've been, I didn't talk about the mouse early on, but they've been trying to get this mouse the whole episode. They finally catch the mouse, and thank goodness to the dog. Guys, I'm Dr. Jen Caudle, practicing family physician, honor health expert, and video creator. I do daily videos on all sorts of health issues. If you've not subscribed, please subscribe to my channel. Follow my channel on Facebook, LinkedIn, TikTok, WhatsApp, Instagram, Threads, you name it. Follow me there. Go to my website, drjencaudle.com, to sign up for my free health newsletter. Love y'all.